Health Director for the Broomfield Department of Public Health and Environment. And tonight we'll be kicking off our COVID-19 update and Q&A session with our City Council members. And so tonight I will be starting the presentation just to give you a little idea of the format. I'll walk through our slides, and we have a great deal of information to share with you tonight. Once I conclude the presentation, we'll take questions from our mayor and city council members that are participating in this session. And while we are conducting the session, members of the community who have joined us may pose a question in the Q&A. We do have members of the Public Health Department standing by to assist with responding to those questions. I will note that depending upon the volume of questions, the complexity of questions, it might not be possible to answer all the questions in real time. We'll do our best, but if we can't, we will be following up and sending an email with the responses to your questions. So if you would like that email response to come to you directly, if we aren't able to answer your question in the Q&A during the course of the meeting, you would need to provide your email contact information so that you can get that information. So with that, I'll go ahead and get us started. And as mentioned, I will be kicking things off tonight. Jason Balling, our director, will be joining us a little bit later in the session. And I am joined by my colleagues in public health and appreciate their help. So welcome, Mayor, council members, staff, and members of the community. If we can get to the next slide, please, Jake. So I'm going to start with the key takeaways that we're going to cover this evening, and we'll run through some more in-depth information and data to support these things. But first, you probably already heard this from the governor and state officials Friday and in the past 3 days, but our hospital capacity here in Colorado is stressed. And while in Broomfield, we continue to experience low rates of hospitalizations, fortunately, amongst our residents, the surrounding counties with high rates of transmission combined with low vaccination rates have really driven up hospitalizations in recent weeks and are causing significant strain on the hospital system. The second piece that we're going to cover tonight is we're going to talk about our case data, what trends we are seeing. Cases have increased in recent weeks and are starting to level out a bit, but we have seen those cases affecting individuals across age groups. So we'll get into that a little bit. Statewide, it's the highest case rates are in our 6 to 11-year-olds and 12 to 17-year-olds. In Broomfield, similarly, we are seeing the highest rates in our younger population, but our numbers are skewing a little bit younger in terms of the age groups with the most cases in the past week or so. We're going to provide a few updates on the COVID vaccine, talk a little bit about booster shots and our plans to prepare to administer them later this month, as well as show the data that continues to reinforce that vaccines are highly effective at preventing serious illness, so preventing those hospitalizations and deaths. And finally, we'll touch on policy updates that have happened since our last COVID update, including the recent announcements by the White House, including a requirement for employers with over 100 workers to require vaccination of their staff, along with some at the state level vaccine mandates that have gone into effect. So next slide, please. So we'll start with just looking at those epidemiological trends. And so on a slightly positive note, we're starting to see a decrease in the 7-day moving average of new cases of COVID. The state epidemiologists cautioned us with reading too much into that at this point, just noting that there could be a little bit of lag in people getting tested and cases being confirmed following the holiday weekend, but we are hopeful that that decrease will continue in the days and weeks ahead. We're, as I mentioned earlier, watching pediatric case rates and hoping that we see those level off as well. Primarily, all the cases in Colorado, both locally and around the state, are attributed to the Delta variant. And finally, as mentioned, we are seeing a trend across the state of hospitalizations continue to increase, and those hospitalizations really being driven by our unvaccinated population. Locally, when we look at Broomfield's data, we are again seeing that steady rise of cases that we experienced throughout July and August starting to hopefully stabilize a bit. And our positivity rate has gone down a bit, which shows a little bit lower levels of transmission. We continue to have really strong vaccination rates locally, so 69.4% of our total population. And when you look at the percentage of the population that's eligible, that's over 80% now of our population is here in Broomfield County is fully vaccinated. The North Central Hospital region that we participate in, as mentioned, is reflecting that increase in hospitalizations trend that we're seeing across the state. And finally, when we look at our case data here in Broomfield, we are attributing the majority of our cases to our individuals that have not yet been vaccinated. Now, we are starting to see an increase in the number of vaccinated individuals that are contracting COVID. And while that is something that we expect to continue to see given the high vaccination rates in our community, the good news is that while we are seeing more individuals who are fully vaccinated contract COVID, we are not seeing those individuals needing to be hospitalized or dying. And so that's good news. And so we have our hospitalization data is there. We had 1 death in the month of August and no deaths thus far in September. So next slide. So let's look a little bit at those hospitalization trends. And the state reported that just under 1,000 individuals across the state as of late last week are hospitalized due to COVID. And ICU capacities are strained. They've dropped under 20%, which has then caused our hospitals to engage in the combined hospital transfer plan, which means hospitals are working together to be able to transfer patients in response to the capacity of their different facilities. You know, the state has reported that they are working to stand up some additional supplemental staffing options for hospitals that are continuing to experience staffing challenges. Additionally, when we're talking with our local hospital partners, they are sharing that they have started taking some other measures, such as delaying elective surgeries or limiting services at specific locations. And so we'll continue to monitor and share that information as it becomes available. So on the next slide, we can look a little bit at, what I was mentioning earlier is what are we seeing if we break it out by vaccinated versus unvaccinated status? And so this is statewide data with the blue coloring representing the proportion of cases across this state that are attributed to individuals who have not yet been vaccinated versus individuals who are fully vaccinated, which is the purple shading. If you go to the next slide, you'll see those same trends continue, but on a much lower scale in terms of numbers when we look at that by hospitalizations. So the next slide will show us how that looks locally. And so we've been able to similarly break it out for Broomfield cases by vaccination status. So the orange is going to represent individuals who are not yet fully vaccinated, and then the blue is going to represent individuals that are fully vaccinated but still contracted COVID. And then that little slice of yellow is individuals that are partially vaccinated. So again, you'll see the greater proportion attributed to the orange, which is the unvaccinated individuals in our community. And if you flip to the next slide, you will see the same representation across hospitalization. So again, small numbers here, but just being able to look at the data this way is helpful. So on the next slide, we will dig into a question, a lot of discussion lately in terms of outbreak data. So we did want to share that with you because the state health department made this data available for the North Central region recently. And so we thought we would share it so you could have a visual. We have seen the total number of outbreaks in the North Central region have increased in September. When you look at the breakdown by what are the types of facilities where those outbreaks are occurring, the most common is healthcare facilities that can include clinics, long-term care, residential facilities, and so forth. The second highest is in that K through 12 population, which are schools. And so we've seen those jump up as more and more kids have returned to school. We do have one outbreak in a K through 12 facility here in Broomfield, and we expect another one to be added this week. Outbreak data is updated on Wednesdays on the State Department of Health website, and we also link to that data from the data page of our website here in Broomfield. So the next slide will give you a little bit of a visual into those pediatric cases, again, with kids back in school. This is a question that we get a lot. So what you're looking at here is the statewide data as it relates to pediatric cases. And like I said at the beginning of the presentation, we're seeing the highest rates across the state in the 6 to 11-year-old and 12 to 17-year-old populations, followed by adults older than 18. Broomfield looks a little bit different. If you go to the next slide, actually this is our overall case data, which you can see again after some weeks and weeks of rising cases. We're starting to see a little bit of stabilization and possibly a decline, which is good. On the next slide, I will show you the pediatric cases that we were looking at the state data a minute ago. Here in Broomfield, we see the highest incidence of COVID transmission in our 6 to 11-year-old population. You can see it rose pretty steeply there in late July and throughout the month of August, and now is starting to tip down a little. The next highest rate is in our 18 and older population. Oh, excuse me, I might have, sorry, our 0 to 5 population has also ticked up there. That's the blue line. And so again, that only in recent weeks, we've seen that jump up a little bit. And then the lowest rate is going to be in our 12 to 17-year-olds when we look at data over the past couple of weeks. And so on the right side, that just shows you for the week ending September 5th, translate that to actual number of cases. So again, we are expecting to continue to see transmission as it relates to the Delta variant, but again, looking at the severity and continuing to see low rates of hospitalization, which is good. So the next slide is going to just quickly touch on when some of the questions, and this is our final slide on case data before we get into some other things. The question has been posed as it relates to cases in school districts that have mask policies in place versus districts that don't. And the state just made this data available this past week, so we thought that we would share it. And you can see when you look at this information, if you follow the red line, and this is looking at right around the week of August 23rd, you start to see a divergence in terms of the cases taking a little bit steeper rate of increase in districts where that masks are not required when you compare them to districts where masks are required. So cases are increasing in both areas regardless, but on a steeper trajectory in districts where mask policies are not in place. So that's hopefully some deeper level dive into the data and what we're seeing on the transmission front. We continue to have the most common sources of exposure be household transmission and individuals simply being active in the community and having resumed their usual activities in sports and social activities and so forth. So now let's talk a little bit about vaccine updates. If you want to go to the next slide, please. And as I shared earlier, we have a lot to be proud of in our community with over 80% of our eligible population fully vaccinated. We have seen the greatest increase in vaccination rates over the past month in our 12 to 15-year-old population, which is, again, a really positive mitigation measure as kids have returned to school. We have just over 21,000 individuals in Broomfield that have not yet initiated the vaccination process, and just under half of those are not eligible for the vaccine. They're in that 0 to 11 population. So we'll continue to share these numbers. We do see them and they're available on our website, and we continue to see incremental growth. We have focused our efforts, as we've shared in previous updates, really doing targeted efforts to reach everyone in our community that is eligible for vaccine and has not yet received them. So we've been working closely with a lot of our nonprofit trusted partners in the community to meet individuals at various locations across the community, including places of employment. We've had some vaccine clinics with some of our nonprofit partners at Broomfield Fish and A Precious Child. We've had events at Broomfield Commons, and most recently we were at Front Range Mobile Home Community this past weekend. So we'll continue those efforts, and we remain focused on trying to really support reaching everyone and removing any barriers to access to the vaccine. So if you go to the next slide, that will just allow me to share a few things that we know in terms of what's happening at the federal level as it relates to vaccines and when can we expect booster shots to get underway here locally. And so, we're in a little bit interesting position because this date of September 20th has been shared both at the state and federal level as the target to start administering booster shots. However, the Advisory Committee on Immunization Practices has not yet released their guidelines to all of us vaccine providers for administering those booster shots. So their next meeting is not slated till September 29th. However, we do expect the FDA to be meeting this week, and it's possible that there will be a meeting that takes place sooner than that. So we're still looking at that September 20th date, and certainly our state officials have continued to plan for that as well. And really what will be important and what we're looking for when we say we're waiting on these guidelines is, we do expect that the guidance will vary in terms of what type of vaccine you have received, prior doses, the timing of when you received your last dose, age, and some other factors. And so we will be sure to be sharing all of that information just as soon as it becomes available to our community. In the meantime, of course, we are planning and readying ourselves to support promotion of access to booster doses to all of our residents. The state shared earlier today, and I believe in a press event, and have been sharing with us locally that they have been assessing the provider capacity here in Colorado. And when they project out all of the individuals that are still in need of their first dose, combined with individuals that are going to be eligible for a booster dose, they anticipate the demand will be between 500 and 550,000 doses per week that we need to be ready to administer here in Colorado. And the state has assessed capacity based on all of the providers that are enrolled and indicated intentions to administer doses that they have capacity to do 645,000 doses a week. So state is feeling like there's sufficient capacity. Certainly locally, we are also talking with all of our partners. We're working with some of our higher risk settings, like our long-term care facilities, to make sure that they're in a good position and have their pharmacy partners poised to support them in administering those booster doses. We have confirmed that both our pharmacy partners as well as the state will continue to have the ability to do on-site pop-up clinics for booster doses, as well as we really do anticipate that there's sufficient capacity in the existing system of pharmacies and primary care providers for individuals to receive their booster doses through those typical channels where they receive medical and pharmaceutical care. So more to come on that. We will continue to stay focused as a health department, really just in that gap filling role and coordinating with all partners to make sure that our community has access. On other fronts, we are in the meantime, while we are waiting for those details on the booster shots to be finalized, just as I mentioned earlier, continuing to try to reach individuals who've not yet initiated the vaccine process on getting their first doses. We've also been focusing on making sure that individuals who are immunocompromised understand that they are eligible for a third dose. So that third dose is not a booster, it's a third dose that's needed just to bring them up to that level of immunity that non-immunocompromised individuals have been able to achieve with full vaccination. So continuing to get that information out and we'll remain focused on those channels as well as the booster shots in the weeks ahead. So let's see, on the vaccine front, I had one more update to share with you on the next slide. And this is just good news in terms of just streamlining the process for people to have digital access to their vaccine records. So you can certainly still have your hard copy of your card, but now there are digital cards available. There is the My Colorado app is where you can store that digital record. And then members of the public can also go to the Colorado Immunization Information System public portal to request a copy, a printable version of their records or their child's records to make those available. So we will also have been and will continue to push that information out to our community as well. And certainly you can always verify with the provider where you received your vaccine that your information is accurate and help troubleshoot if need be. So finally, let's wrap up with some policy updates. And the final slide, please. As mentioned, the Biden administration last week released a 6-point plan that includes mandatory vaccination policies for private employers that employ 100 or more workers. And honestly, at this time, we don't have a great deal of information beyond that. We know that OSHA will be issuing regulations in the coming weeks. And so until we really see the specifications of that, it's difficult to say, who all is encompassed in this and what some of the details are. And certainly, there's a lot of dialogue and discussions across all levels on this. And so we will continue to make information available as we get better information here locally. As far as the state landscape, I made reference to this earlier, but the State Board of Health had an emergency rulemaking hearing at the end of August, which put into place a mandatory vaccination requirement for all staff and contractors working in health facilities. So that includes hospitals, community clinics, long-term care facilities, residential facilities. And so the first staff and contractors working in those facilities are required to have their first dose by September 30th and be fully vaccinated by October 31st. That was followed this past week with some updates to the guidance that the state health department issued for schools that provided some additional guidance around ventilation and supporting schools with integrating enhanced ventilation into their mitigation measures, as well as recommending universal masking, and finally changing the metric associated with modifying quarantine guidance. And so really encouraging that metric to be focused on school communities that have 80% or greater population vaccinated, and creating a pathway for schools to request their vaccination data. In the regional area, the metro landscape, the feedback from the metro area has been that it is challenging in terms of different counties and municipalities implementing their own policies and really encouraging statewide action, particularly for those sectors that are serving vulnerable populations, to bring some consistency and continuity across the board. In the meantime, though, Denver has issued a local mandate requiring vaccines across specific sectors, and Boulder has issued an indoor mask requirement for their facilities in their community. So in terms of implications for Broomfield, again, as mentioned, until we get some of the specifics of what the regulations coming out of the Biden administration plan will entail, we aren't able to give specificity to the implications on us as an employer, but we are, as any health facilities that would be operated by the city and county, so that includes the health clinics operated by the public health department, do need to comply with those state board of health regulations. So we're working on getting those policies in place currently. So I know that was a lot of information. A lot has happened since we last met, but with that, I will conclude the presentation, and we can take questions from our elected officials. Trying to see if any hands are up. I don't see any. Oh, excuse me. Okay, Councilmember Schaaf.
I'm always good for a question. So I'm curious. So with the folks that had vaccines, say January, February, March of 2020, I think at this point, or was it 2021? But for folks that got those vaccines at that point, what is that length of the efficacy of those vaccines? I mean, do we expect that, in a year's time that those are going to really start to go down, and is that why that booster shot is coming?
Yeah, thanks, Councilmember Schaaf. And so the reason for the booster doses is that we are starting to see waning immunity after 6 to 8 months as it relates to contracting the COVID virus. And so I want to be careful here in that, what has not changed is that the vaccines, even after that amount of time, remain highly effective at preventing serious illness or death. But we have, as you saw in our data, started to see increased transmission. And so individuals are still contracting the virus, even though they are not getting seriously ill. So in order to provide an additional layer of protection against transmission, that's why that booster shot is being recommended. And so I anticipate that, if we're talking about September, late September, early October rollout, there will be some individuals that who were in that first group that will be more inclined to get their booster dose sooner than later, compared to others that may have gotten vaccinated in the spring or summer.
All right, so the vaccine for that third dose is going to be rolled out in a similar way that the original vaccination was rolled out.
Correct. At this time, we don't have any specific guidance that has been issued by the state or federal entities in terms of, that phased approach that we saw. So, I think it will look a little bit different than what we saw. And part of that is we have a vaccine that is now widely available, and we have significant more opportunities through enrolled providers for individuals to get the vaccine. So I think, we may have the recommendation based on when you received your last dose, but it will not, at this time, I don't think we'll see the need to do the same strict of phasing as we saw previously. But again, we don't have all the information yet coming out of how the recommendations are going to come from the state or federal entities on how to operationalize that.
And then last question. So speaking of vaccines, we are headed into flu season as well, and flu shots are starting to be administered. Recommendation is still to get your flu shot. And what I assume that was what my doctor said. And then with the flu season, do we have any data to see has there been an uptick in the flu season in other parts of the world? Do we expect this to be a strong flu season, or do we expect it to be light like we saw last year?
Yeah, those are great questions. And thank you for the public service announcement about getting your flu vaccine, because that is very much in alignment with what we recommend. And I think, again, as we start to move from, the idea of a COVID pandemic to more of this endemic, that this is a virus that we are living with, we will start to see more regularity in terms of the vaccines that we recommend getting on an annual basis. And so we do continue to recommend that everyone does receive their flu vaccine. I don't have projections yet, and so that might be something that we could follow up in the CMO update in terms of after we consult with our epidemiological staff about the projections for the flu season. I don't have that off the top of my head, but thanks for asking it. We'll follow up.
Okay, thank you. That's all I have.
I saw Mayor Castriato's hand up.
Yes, thank you so much, Deb, for that update. You really answered most of the questions I had. My main quandary, I guess, is what's the proper way to handle a potential exposure? If you have been in contact with somebody who's tested positive, do you recommend a self-quarantine, and then who do you notify? What are the best practices for that?
Sure. So one of the major things that we're going to take into consideration is the vaccination status of the individuals that have been exposed. And so if you are fully vaccinated and you've been exposed to an individual who tested positive for COVID, you're not required to quarantine, but we are going to certainly recommend that you monitor for symptoms. And it is advisable, and we are recommending, just given the high level of transmission that we're still in, that you would seek a COVID test within 3 to 5 days of being exposed. If you are unvaccinated and you were exposed, or perhaps you're partially vaccinated, you haven't received your final dose, and you were exposed to a positive case, then that would be a situation where you are required to quarantine. We recommend 10 days, but there is, certainly the possibility that you can test for COVID between days 5 and 7 if you don't have symptoms and you're not, for instance, working in a setting around immunocompromised individuals. You can be released from quarantine after day 7 with a negative test. So that's the details on that. That is a situation that I think, people thought was behind us. And now with this level of transmission in the community, we have a lot more individuals needing to make those decisions. So thanks for bringing it up.
Thank you. It's good to know. That's all I have. Thanks.
Sure. Councilmember Anderson.
Thank you. I do have a question. We receive a lot of emails about the vaccine passports and vaccine mandates. And I'm just curious if, I think I've seen this in the past, where if there is a vaccine mandate put in place, and I think you said you had to still see the details of what the Biden administration is planning, that there's usually an exemption, like a personal exemption or religious exemption, that some people will claim, those who really have I suppose, a strong feeling about it, but that it actually leads to more compliance. Is that what we expect again? That if individuals could claim an exemption if they needed to, but that the goal would be that the compliance rate would be higher to getting the vaccines to help stop the spread? Is that fair?
Well, I mean, I think, our recommendation as a local public health department is that we continue to really promote vaccination as the most effective strategy for preventing serious illness and death related to COVID. And certainly we want to layer that with other mitigation efforts. So if an individual, for instance, is not willing or able to become vaccinated, then, having those other mitigation measures, wearing masks, routine testing, ventilation, all of those things are really important for keeping transmission low. And so I think there's, certainly a lot of debate about how to operationalize vaccination and what makes sense for different entities. And, certainly it's within the purview of private employers to set their own policies in terms of their requirements for their staff. And so I think as far as the health department, we're really, our primary focus is just promoting vaccination as the most effective way to suppress the virus and move us out of this pandemic phase that we're currently in.
Sure. And then I do have one other question. There's been at least, there's the one confirmed outbreak at a school and potentially another one. Do we know if from those outbreaks, do we know how that started? Like, is it grades that aren't vaccinated yet? Or is it like more vaccinated children, but was it occurring like a lunchroom setting, on a playground? I mean, do we have any idea where that was the source of that spread? Thank you.
The existing K through 12 outbreak that we have on record was in a K through 12 classroom involving unvaccinated individuals. I don't have details on any additional outbreaks, but certainly when the outbreaks are reported on the state website, you can look and it will show the number of cases and whether they were students or staff affected. And so we'll continue to share that information on our website.
Okay, thank you. And I do have a follow-up question to that. So if we were to start to see trends in the outbreaks, that could potentially, or could that potentially lead to additional changes in recommendations for the schools if we start to see a transmission via certain like from the cafeteria or band room or what be it could potentially lead to additional recommendations?
Yeah, I think that's a good point. I think, we're always gathering data, right, about the source of exposure and what the different components are. And so you're right. I think if we gather data, that would lead us to any additional mitigation measures. And that's part of the work that our team does do with schools as we investigate these cases and really support entities from, if they do experience an outbreak, how to prevent it from spreading or to get further, as well as, any entities in the community to prevent them in the first place. So you're right. We will continue to look at source data and see if there's any recommendations. But in the meantime, really taking that layered approach is so key. And so we continue to really focus on ventilation. Take things outside if you can. Wear face coverings. Ensure that not only individuals are vaccinated, but that members of their household are vaccinated, really focusing on hand hygiene and all the things that we've been saying throughout. But, if we get data to identify further trends, we'll continue to look at that. And if outbreaks are occurring in certain settings or in certain situations, then that does warrant us to make some additional recommendations or add some further preventive strategies in there.
Okay, thank you. And I think those are all the questions I have.
Just scanning to see if any of our other council members have their hand up. I don't think I'm seeing anyone. All right. Well, with no further questions from Mayor or our members of council, then we will, as I mentioned at the beginning of the presentation, we've been working to respond to the Q&A questions throughout this session, and we will follow up with any of the individuals who we weren't able to answer the question live via email if we didn't get to it in real time. So thank you all for your participation today, both this session as well as the questions that we responded to in the Q&A are posted on our website following each of these. And our next session is slated 2 weeks from now at 5 p.m. So thank you all.
Thank you so much, Deb and team in public health for all you do. We appreciate you. Bye.
Thank you.